Welcome, everyone. I am Ameya Asarkar. I'm a head and neck surgeon and the director of head and neck robotics at Ochsner LSU Health, Shreveport. And I'm pleased to moderate this seminar entitled Expanding Options Alternative Therapies for Head and Neck Cancer Patients. Thank you all for joining. No matter where you are in your cancer journey, whether in active treatment or survivorship, this webinar offers guidance on complementary approaches that can potentially support healing and improve day to day well being. Our panel includes an expert clinician who will discuss therapies like acupuncture, nutrition, mindfulness, and physical rehabilitation, sharing what's known about their benefits, limitations, and safe use alongside conventional care. You'll also hear inspiring stories from three survivors who have embraced many of these practices as part of their recovery. I would like to mention that when exploring alternative therapies, be sure to discuss them with your medical team, as these approaches may be helpful for some individuals, but not suitable for everyone. This webinar is also be recorded for those who may have to leave early. We also provide a survey for you at the end of our seminar. And we are encourage and welcome all any questions throughout the webinar. Please feel free to type them up in the chat box or the Q&A throughout the webinar. Without further ado, I would like to introduce our first presenter, Alliance member Chris Molnar. Chris Molnar, who is a survivor of tonsil cancer, a 20-year-old survivor who has navigated months of challenging treatments. Since then, she embraces life each day, enjoying time with her many dogs, horses, and other animals on her West Virginia farm, cherishing moments with friends and family, and spreading positivity to everyone she meets. As a farm owner in Wheeling, West Virginia, Chris understands the importance of cultivating and maintaining a healthy, balanced outlook on life. Chris?
Good evening, everyone. As Dr. Oshmar said, I am a 19-year tonsil thriver is what I call it, because having cancer and getting out the other side was the greatest gift I was ever given. But what I want to do tonight is tell you a little story about my journey from radiation fibrosis related stroke to Reiki master, and what knowing about Reiki energy and helping others with it has done for me. So let me begin my story. About 4 years ago, I had a stroke due to a carotid artery blockage resulting from radiation fibrosis. Before I go any farther, I want to recommend to all of you that you ask your healthcare professionals about having an ultrasound evaluation to make sure your carotid arteries are in check. But let me go on with my story. About 4 years ago, I had this stroke, and I was life flighted to a hospital in Pittsburgh where I had had my cancer treatment. And in order for me to become well again, I had to have surgery, and that surgery was involving removing a brain bleed and putting a stent in my carotid artery. And that evening, I had to remain awake during the procedure so that the doctors could make sure that my brain was intact. And as I was lying there on the surgical table, this light appeared, and this is an important moment for me. The light appeared from above, and I saw myself from down on the table, and I was looking down at myself from above. And as I was doing that, I said to Chris on the table, "Don't worry about anything." I talked to God, and he said it's going to be okay. So for me, as that determined individual, I thought, I'm going to be okay. So let's see what opportunity comes. I left the hospital and the ICU approximately 4 days later. The paralysis that had been on my left-hand side was no longer there. But I had a lingering issue with my brain and being able to think and compose at the same time. So I did significant investigation into neuroplasticity. And so I could take the time to repair my brain because my brain typically whirs and I needed to settle it back down again. So some of the things I did was I ended up spending a great deal of time with our animals, with our dogs and our horses. One of my favorite times in the winter is bundling up and going down to the barn and being able to feed the horses the hay that they need every day. And it calms my soul and makes me feel terribly secure. One of our dogs named Cork, and this is part of my story. One of our dogs named Cork had a knee injury, and a woman by the name of Becky did therapeutic massage on our dogs, and she does it on horses as well. And Becky would come weekly to talk to us about our dog Cork as she massaged him. And she began to tell me about Reiki, and I really didn't know what it was. So I'll tell you what it is. It's a universal life energy and being able to share that with others. Next slide, please. So as Becky and I conversed, she introduced me more to Reiki and told me about it and showed me how she employed that with animals. And as time went on, the two of us started talking about a class that she was having to become a Reiki master. So a couple months later, I joined with her and three other phenomenal women and spent some 40 hours becoming a Reiki master over several days. And I found that the sending of my energy to others to do good for others has given me the best personal gift that I could ever have imagined. And each night before I go to bed, I send this energy to my friends and the people that I love who need some support. During the day, oftentimes I find myself thinking about the people that I care about, and I send that energy their way. This particular slide that's in front of you right now is showing me with a fob or a pendant in my hand. And I have that fob right here. And as you can see, it's going around and I'm not making it do that. So maybe I can make it stop. And that's a sample of the energy flow. But I want to share a couple of experiences that will give you more of an understanding of what Reiki does and how it feels. Using that fob about a year ago, my brother said to me, we have that water leak down by the barn. Do you know of any way we could find out where the leak is? And it was in a length of 75 feet. And I said, well, let me get my fob out and see if I might be able to find it. So I took my fob out almost where the photo is right here, and it guided me to a spot and stopped just like it did a moment ago. So I thought, well, the leak must be there. So I put a rock on top of that spot, and my brother got his backhoe out and he said, where should I begin? And I said, on that spot. And I'll be darned, the water leak was right below it. Another situation where I have felt the flow of energy significantly is at the symposium. We had a sound bath at the very end of the day, and during that sound bath, they were using a drum that swirled around, and as that sound was moving, energy came toward me, and it was fierce. But what I was able to do is take that energy and flow it back out. For some of you, you probably think, geez, this sounds crazy. But what it's given to me in being able to share my energy with others, it's been a gift that I could not have even imagined. So consider Reiki as a way to calm your mind and clear your soul. Thanks for the opportunity to talk this evening.
Thank you so much, Chris, for sharing your story with us. Moving on to our next speaker, Dr. Florence John is a physical medicine and rehabilitation physician and an assistant professor and director of the Department of Rehabilitation Medicine's Cancer Program at the University of Minnesota. She is also the Physical Medicine and Rehabilitation Residency Program Director at the University of Minnesota and oversees resident trainings in this specialty at the institution. Dr. John has worked collaboratively with oncology and surgical teams to build a robust cancer rehabilitation program at the university that benefits cancer patients across the spectrum of different cancer types. Dr. John's research interests are primarily focused in cancer rehabilitation, resident education, health disparities, and global rehabilitation. Dr. John.
Thank you so much, Dr. Asarkar, for that introduction. And good evening, everyone. I'm very happy to be here this evening to talk with you about rehabilitation considerations for head and neck cancers, and just tell you a little bit about what I do in my practice and what we as a rehab team can do to help with some of the symptoms that you experience along your journey. So to start out with, I usually go over what is a physiatrist. When I have patients that come in to see me for the first time in clinic, the first question that they often ask me is, Dr. John, I'm not exactly sure why I am here today. Or Dr. John, what exactly is a physical medicine and rehabilitation doctor or a physiatrist? So we call ourselves PM&R doctors for short. That term is synonymous with a physiatrist. And we are basically a medical doctor that completes an MD or a DO degree, a Doctor of Osteopathy degree. Once we finish medical school, we do 4 years of a medical residency, and our residency is primarily focused on musculoskeletal health, neurologic health, and the nervous system. And we really are focused on restoring function, reducing pain, and improving quality of life for our patients. Within the specialty, there are many subspecialties, and I work specifically in cancer rehabilitation, as Dr. Asarkar mentioned. So I work very closely as part of a multidisciplinary team at the University of Minnesota, and amongst the many things that I do to help patients, one of the main things I do is really help formulate and oversee a rehabilitation plan. And this can be anywhere from the time of initial diagnosis through survivorship at various stages. So I always start any cancer care presentation I give with the story behind my why. As with many of us, our personal journeys and experiences shape our professional journeys, and it is the same with myself. So those pictures here on this slide on the top are of my father, who at age 67 was diagnosed with stage 4 pancreatic cancer when I was a first-year medical resident at the University of Minnesota. And so I walked that journey with him as a daughter, as a physician. He lived on the East Coast in southeastern Virginia, which is where I grew up. And so I was flying back and forth between Minnesota and Virginia about 3 or 4 times a month to be with him throughout his treatments, be it chemotherapy, radiation, and a major surgery, and his recovery periods. And so I really saw as a family member and as a doctor what he went through, in terms of his recovery and just some of the struggles that he had regaining his strength back and his mobility and getting back to his day-to-day activities and what he enjoyed. And so I think that was the catalyst for me in terms of why I chose what I chose for my specialty and working with cancer patients. And it's what brings me a lot of joy and satisfaction on a day-to-day basis. And he continues to inspire me in my work. So, just a brief overview of what I'll talk about today. So, we'll talk about understanding what head and neck cancer rehab is and how we can help, and some of the functional challenges that we see in our clinic, and the management options that we offer for those as well. So, to start out with, what is head and neck cancer rehab? So, this is a whole team. It's a PM&R doctor, physical therapy, speech therapy, occupational therapy, and as I mentioned earlier, we work very closely with the rest of your cancer care team. And it is a very much a multidisciplinary approach to help you recover your functional abilities that might have been lost along the way, along your cancer journey, in terms of various treatments and surgery. And so we are all about goals in rehab medicine. And so one of the first questions I'll often ask my patients when they come in to see me in clinic for a first visit is, what do you want to be able to do? What do you want to be able to get back to that you're not able to do right now? And what we do really works towards those goals. The other thing I will say is that even though we may be managing specific symptoms that you might be struggling with, one of the things we pride ourselves on is we really do or deliver holistic care, and so we look at how those symptoms are affecting you as a person and your function and your ability to do the things that you love. And so that's really the crux of what we do in trying to get you back to those on a daily basis. So, I want to talk a little bit about prehabilitation. We call it prehab, and I know many of us are familiar with rehabilitation, the term rehab, and that is when we are trying to get you stronger again after treatments and get you back to your full level of functioning. Well, prehab has gained a lot of traction in the medical world, and it is basically moving things up much earlier in the timeline. So, at the time of your diagnosis or shortly after your diagnosis, if your oncology team or your surgical team notices, at those first few visits that maybe you seem a little bit frail, your strength, you're feeling a little bit weak, or they notice some weakness on their exam, or you have some difficulty swallowing already, they will actually refer you to a rehab team, including myself as a PM&R physician, to really optimize your function physically as you start treatments, or even prior to a major surgery, because there is a lot of clinical research trial evidence, a lot of multi-center trials that have been done for different cancer types that have shown that if we can get you optimized physically at the beginning of your journey, that we can actually help you tolerate treatments much easier, and that your recovery from any surgery will be better, usually smoother, and shortened hospital times for a lot of cancer types. And so that's the crux of why we do what we do with prehab. So when you get referred to a rehab team, our goals include optimizing your strength, your neck range of motion. We take a look at your swallow function and make sure that is optimized in a variety of different ways. And if you have any coexisting conditions or weakness that is affecting your gait and your balance, we will work with you to get you stronger. And then a big piece of prehab is also optimizing nutrition. And for myself as a PM&R doctor, one of the aspects of nutrition that I'm always concerned about is protein intaking and making sure you have enough of that every day, because we know that the protein does go to your muscles and keeps those muscles strong. And so that's something we talk with you about, and we connect you with one of our nutritionists as well. So lymphedema is another condition that I see very commonly in my clinic, and lymphedema is a chronic swelling that develops due to disruption of the lymphatic system. So the lymphatic system is a system of vessels and lymph nodes that are spread throughout our body and interconnected, and they are responsible for carrying lymph fluid, which basically carries waste substances to help our body excrete them, and then also carries other metabolites and substances to be delivered to tissues. And so through either radiation or surgery, sometimes that lymphatic system can get disrupted. And you can see the diagrams on this slide. On the left side, it's just to highlight all the groups of different lymph nodes that we have in our head and neck region, just to show you how many there are actually in that one region alone. And then the other diagram there with the Roman numerals just highlights some of the lymph node regions that the surgeons consider when they go in to do surgery and remove a tumor or in the cancer area. And so if the lymphatic system gets disrupted, what happens is the normal flow of lymph fluid is disrupted, and the fluid sometimes wants to exude out into the surrounding tissues, the soft tissues, and that's how you develop a swelling. And so the picture here on this slide shows an individual with swelling in that below chin area, the front of the neck, and the side of the neck as well. And you can also see some scar tissue there too. And so what do we do to help manage that lymphedema? So usually I diagnose it in clinic, I will refer you to one of our lymphedema therapists. And so these are physical therapists or occupational therapists by training that have a special additional training in swelling or lymphedema management. And usually this is managed in two phases. The initial or first phase is that they will educate you on the swelling itself and on skin care, which is really important, making sure that the skin is well moisturized and not dry and brittle in the area of swelling. They will also do what we call manual lymphatic drainage, and I describe this as a purposeful massage to help push the lymph fluid through the vessels and help your body excrete it, and that can decrease swelling. And then they will also sometimes prescribe compression wraps and various exercises to help move fluid through that area and stretch those muscles. Once they get the swelling under good control, then we move on to the next phase, which is called the maintenance phase. And so usually in this phase, you'll be fitted for compression garments as demonstrated on the slide here, on the picture on the left. And then they will also teach you some daily stretches and self-lymphatic massage that they did with you in their sessions so that you can continue that at home on a daily basis. Occasionally, if we have patients where we try all these measures and the swelling is still prominent and is not really going down, then we will, either myself or our therapist will prescribe what we call a pneumatic compression device. And so this is basically a lymphedema pump. It's an electric pump, and this is highlighted in the picture on the right here, where you see this individual sitting with this chest vest piece and head and neck piece. And it's basically connected to an electrical outlet, and it electrically pumps the fluid for you instead of doing it manually. And you would use this regularly every day during the week. And so that has had some good success. There are several companies that make these pumps, and we prescribe them in specific situations. So coming to radiation fibrosis, this is another condition that I see in clinic, and I know Chris mentioned it in her part of the talk. And it is something that a lot of patients do struggle with, and it is one of the later effects of radiation. We see it weeks to months after radiation, and this is when the tissues in the area that has been radiated can become scarred and thickened. And I really like this diagram on the right side of the slide because it highlights all the layers that can be affected, starting at the top from the skin, and then those yellow beads are the fat layers, and then there's a fascia layer, which is kind of a connective tissue layer right before the muscle. And so if you develop radiation fibrosis, it can affect all of these layers. And then what is not pictured here is superficial and deep nerves that actually run through these layers. And so you can imagine if you develop scar tissue, that scar tissue can clamp down and tighten around the nerves, and then you can develop nerve symptoms and nerve pain. So what a lot of patients come in to see me in clinic for is neck stiffness, pain, limited jaw movement, and neck movement, and then nerve pain and muscle spasms. And then in some cases, if the tissue is tight enough, the scar tissue on one particular side of the neck, it can actually pull on that shoulder. And then if you've already got existing arthritis in that shoulder, those symptoms can become worse. And sometimes you can develop a rotator cuff tendonitis or inflammatory changes that we manage as well. And so, what do we do for radiation fibrosis? I always say there are a few different components to what we do, and we have lymphedema therapists. Again, they don't just manage lymphedema, but they also manage scar tissue and radiation fibrosis. It's one of the things that they do. And then myself, in terms of what I do as a PM&R physician, and I tell patients that we can do one or the other. You can go to a physical therapist or just a PM&R physician, but really what we each do complements each other so much. And so I often will recommend that patients go through both types of treatments at the same time. So physical therapy does a lot of stretching, strengthening exercises for the muscles of the neck and shoulder, stabilization techniques to help improve neck range of motion, and then they also do what we call manual therapy or myofascial release. And so I describe this as another type of purposeful massage, where they go in and try and loosen up some of that scar tissue, and it can be really beneficial and help improve range of motion and mobility of the neck. They also do a lot of postural training and ergonomic adjustments to help. In terms of what I do in clinic, I will do a diagnostic evaluation of the neck and shoulder symptoms that patients might be experiencing. And I really try and tease out, is it mainly the muscle, the tight muscle that's causing symptoms, or nerve pain that's the large contributor to symptoms, or are there joint sources of pain in terms of that shoulder joint? And so I will offer medication management for nerve pain and muscle tightness or spasms, either oral medications or topical medications. And then sometimes when we try all these conservative measures between what therapy does and I do, and patients are still struggling with a lot of muscle tightness and spasming and limited range of motion, there are injection options that we offer, that we do in clinic as PM&R doctors. One of them is called trigger point injections for myofascial pain, or pain in the muscle and fascial layer, that I showed you on the previous slide. And these are basically injections that combine two different numbing agents. And I'm going to actually go back to the previous slide here and show you. And so we inject a little bit of those numbing agents in between the fascia and the muscle layers. And what that does for some patients is it just breaks the pain cycle and gives you some long-lasting relief for several weeks to months, which can be really beneficial. The other types of injections that we do in clinic are Botox or botulinum toxin injections. I know that they are very well publicized for cosmetic reasons, but I often tell patients that actually Botox injections have been used for many decades for tight muscles, for our stroke patients and brain tumor patients who have tight limb muscles, and then also for head and neck diagnoses when muscles become tight as well. And so that Botox is a local targeted muscle relaxant. And so for patients for whom we feel this is indicated, we will inject a little bit of the medication into the underlying muscle that underlies the scar tissue and the fibrosis, and relax that muscle a little bit, which can give you a little more mobility and relieve some of the discomfort that you experience with this. The caveat I will say is that with any injections, I will often talk with the oncology team, the surgical team, and just make sure from their perspective it is okay to proceed with these. And every individual is different. So based on your history and what types of treatments you've been through, I really make the decision on an individual basis whether injections might be appropriate for you if you're still struggling with symptoms. If nerve pain is the big component, sometimes I will refer patients to one of our pain medicine doctors who does nerve blocks. They do them ultrasound guided in clinic. And what they do is they go in and they just inject a little bit of numbing agent in and around the nerve area to help, again, block those pain signals and give relief from that nerve pain. And then lastly, if there are shoulder joint issues, either rotator cuff issues or arthritis symptoms that have been worsened by the tight muscles, we offer steroid injections that we do in clinic to help with those joints as well. So I want to touch briefly on cancer-related fatigue. This is another symptom and complaint that I see quite often in my clinic, and I describe it to patients as really multifactorial. There are a lot of different factors that play a role in weighing your body down and having you feel that low energy. It can range from the disease process that you went through to the treatments that you went through for your cancer. And then there are other factors that sometimes get overlooked, like are you sleeping enough at night, or is your sleep disturbed, either because you're waking up or because you have pain and the pain is keeping you awake. And so pain is another big factor that can weigh your body down. And then we also look at labs, any nutritional deficiencies, if your protein level is low, or if you have anemia, that red blood cell count or hemoglobin is low, or you have electrolyte abnormalities as well. The last thing I'll say is that emotional distress or anxiety, depression can also play a huge role in overall weighing your body down and giving you that low energy. So I really look at this very holistically, and we try and address each and every one of those components in clinic. And so what do we do if a patient comes in that's been really struggling with fatigue for many months or years? I will look at labs, and if certain labs have not been ordered, I will order those in my clinic just to check out some treatable, some things that we can treat, some conditions that we can treat that might be contributing to making you feel more fatigued. And that can be anything from a low vitamin D level to a low thyroid hormone level to anemia, as I mentioned earlier. And then, of course, I manage pain symptoms that might be weighing your body down or keeping you awake at night, and the emotional health aspect as well. I will say that exercise is a huge component of combating fatigue. And a lot of patients, when they come into clinic and we mention exercise, it seems very counterintuitive. They'll say, Dr. John, you're asking me to exercise more and I'm feeling so tired. And the way I explain it, it is a very difficult cycle. When you are in pain or when you are very tired, your body is not as active. You don't move those muscles as much. And when you don't move those muscles as much or have enough endurance activity, the release of excitatory substances in your body and your system is inhibited. And so it makes you even less mobile. And so that cycle goes on, and we have to break that cycle. And so our physical therapists are really great at helping with that. And then I will often refer you to a cancer rehab occupational therapist for fatigue management because they can really help with a lot of different fatigue management strategies to help you better manage the fatigue on a daily basis. So lastly, I just want to touch on swallow and speech function. I'm not going to talk too much about this because I really defer to our speech language pathologists, our speech therapists, as they are the experts in this. Here at the University of Minnesota, they are involved very early with our patients. In fact, initially at the time of diagnosis or shortly after diagnosis, they see our patients, head and neck cancer patients, will see a speech therapist, and they're actually embedded in our head and neck cancer clinic. And so they will look at all the symptoms and do a variety of different things that are needed at that time, including swallow studies. If swallow function is already affected, they work very closely with our nutritionists, and we try and get the nutritionists involved early as well to help just give you good advice on your diet and advance your diet. And then if speech is affected, they really have good methods that they use for training to improve articulation, and some devices as well. So to wrap up here, some of the key takeaways that I wanted you all to get from this talk are: early rehab means better long-term functional outcomes. Exercise, mobility, and self-care programs help reduce the burden of some of the symptoms that you may experience. And then you've now, if you didn't know already, you know what a PM&R physician is, and that we integrate medical and functional management and recovery. And then I know I've mentioned it earlier, but every individual's journey is unique, and really individualized plans are key. Um, and let's see here. And I wanted to end with a quote. So Nancy Hutchison is one of the stalwarts of cancer rehab. She is a PM&R physician, really one of the pioneers of our field, practiced for decades and was world renowned, and actually based in Minnesota. And she's now retired and was one of my mentors. She had a great quote. She said, do cancer survivors in general, do they want to survive or actually thrive? And we know the answer to that question. All survivors want to thrive. You just want to get back to doing what you love, your daily activities, your quality of life. And sometimes we know that addressing function and exercise for survivors you can feel like you're training for a marathon or climbing a mountain, because you have good days and days where you don't feel so good, and you sometimes have medical detours along the way. But just remember that you have a whole team behind you, including your rehab team, and that is our goal, to get you back to doing what you love and improving your quality of life. It's really one of the most rewarding and appreciated interventions that we as a rehab team experience. So I think that is the end of my portion. Thank you all so much again.
Thank you, Dr. John. That was an excellent presentation. Uh, I think we should continue posting questions in the Q&A tab. We will take questions as we go, and if there are any unanswered, we can take them at the end of all this presentations. So the next presenter is Jonathan Hutton, who is a survivor of recurrent nasopharyngeal adenocarcinoma. Jonathan has lived with aggressively recurrent and rare nasopharyngeal cancer for over 10 years, a journey that began at the age of 30. His experience has been improbable and transformative, encompassing the challenges of intensive treatments, life altering reconstructive surgeries, and significant side effects. But Jonathan approaches his story with courage and a sense of humor. He believes that hardship can broaden perspective and deepen our connection with ourselves and others. Jonathan has found healing and contentment in life through friends, family, and yoga. In 2023, after recovering from surgery, he pursued a long held dream, learning to fly paragliders, embracing new adventures with determination and joy. Jonathan?
So, okay. Like I mentioned, three things I'm going to speak about today related to meditation: how I found it, how I've used it in my healing journey, and what I've learned. So, my journey, like Dr. Asarkar mentioned, began over 10 years ago when I was diagnosed. Um, so much has happened. It's been such a long journey. I had to make a diagram to remember everything, and that's what this is. We've been talking a lot about radiation, and a lot of us who've dealt with head and neck cancer have undergone radiation treatment. I have twice, and it's not a fun thing to put your body through. Neither is chemo, right? So I did radiation twice, and the kind of idea was, oh, you're young, we're going to do aggressive treatment, and the hope was that would be a pathway to a cure. But really, what it caused, unfortunately, was a cascade of other problems. Um, there was a decent amount of time that went by between really the onset of pain and lethargy, to really understanding that what I had developed was osteoradionecrosis, and then developing a plan to deal with it took even more time. During that time, Dr. John mentioned pain specialists. I saw a pain specialist, um, and I knew I wanted nothing to do with strong opioid pain medications, but nerve pain meds helped me for a while. And then one of the clinicians I'd been seeing referred me to uh, a study that was around guided meditation, um, and using guided meditation techniques in pain management. So this was my gateway to meditation practice, which is something that I do essentially every day, a lot like writing. So I want to talk a little bit about how I use meditation. Um, of course, just learning how to meditate didn't cure skull base ORN, but it did help adjust my relationship to pain, right? My reaction to it. And it helped me build a new sort of awareness, an ability to treat sensations, pain as information. During that time, I was able to continue to work, which is really important to me. And I'd found a way to deal with discomfort without constant distress, right? Which would come in handy later on. Ultimately, to deal with the ORN, I underwent a couple free flap maxillary reconstructions to fix the damage to my skull from radiation. And recovering from those surgeries was nothing like the cancer treatment, radiation and chemo. So that sickness, radiation burns, mucositis, those things were awful, 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 but they were temporary. Reconstructive surgery was different in that the way my jaw and throat functioned was permanently changed. And a big part of my recovery was coming to grips with that fact and accepting that I was different, that I had new limitations. Um, I needed to let go of that old concept of who I was. So I would sit and meditate, um, often incorporating gentle stretching. My jaw needed and still needs to be stretched every day to stay ahead of trismus. And I didn't want my neck to get stiff either, so I developed that practice of stretching. And over time, what happened is I built a practice of showing myself, my body, compassion and care. And this really helped contribute to my sense of wellness and helped me heal in really profound ways. So today, I think about meditation less as a daily checklist item. Mindfulness is more a way of moving through life. I think that everyday things can be meditative. Moving slowly in traffic, walking our dog, sitting and writing. Um, I mentioned flying, so it's not something I do every day, but I use some of those same techniques to find focus and calm and to settle my mind before I launch. Okay, let's talk about what I've learned. So, mindfulness meditation is something that's deceptively simple. The main thing that gets in the way is really all the noise and chatter of your own thoughts, your worries, your fragmented attention span, your phone, your desire to optimize, to level up, to win at meditating, which is a trap you can fall into. Um, but as you learn to be less reactive to thoughts arising in consciousness, less attached to them, less judgmental, you're going to change. I'm quite certain of this. Um, Another thing that comes to mind, there's really immense utility in decoupling your thoughts and your maybe rigid notions of your identity, decoupling those things from who you are as a person. So you're not your thoughts, you're not familiar ideas of how you should look, how your body moves, the sensations you have or don't have. These things get shaped over years and decades of being alive and tend to settle into a form that can feel permanent, durable, fixed, but it's not at all. This is something I had really had a rough time with, but um, I had to let go of who I thought I was, and eventually my perspective changed. Meditation helped a lot. Another thing, so am I flying, am I writing, even kind of day to day, I find it's really important to step outside of yourself to consider how small you are compared to the mountains, the atmosphere, the universe. Finding time to be awestruck is a great way to shift your perspective, to appreciate the present moment, and to get unstuck and move past unhelpful habits and patterns of thinking. There are many ways to get started with mindfulness meditation, apps, books, classes. It can be a transformative part of healing and everyday living. Thanks so much for your time and attention today, and looking forward to our panel discussion. Thanks all.
Thank you so much, Jonathan, for sharing your story with us. Moving on to the last presenter for today, Brenda Newberry is a survivor of tongue cancer. Brenda's journey with cancer began long before she received her diagnosis. For over 5 years, a persistent red tender spot on her tongue was monitored by her dentist and doctor. Despite undergoing 3 biopsies, all read as benign, she was told it might be oral lichen planus. In February of 2012, Brenda was diagnosed with stage 4 tongue cancer. Her treatment included a hemiglossectomy, a neck dissection to remove 23 lymph nodes, reconstruction of her tongue with a flap from her arm, and a skin graft from her thigh. Today, Brenda embraces a proactive approach to wellness. Her routine includes walking, cardio, and strength training, a whole food, plant based diet with targeted supplements, meticulous oral care with regular dental cleanings, and daily yoga practice. She also enjoys yoga retreats, including trips to Costa Rica, as part of her ongoing journey to balance healing and joy. Brenda?
Good evening. Thank you, Dr. Asarkar. Yes, my journey began 5 to 7 years before I was finally diagnosed. And I did undergo quite extensive surgery. In fact, I woke up with a scrape on a ventilator as well as a feeding tube. So the treatment was very tough. As you know, radiation is not easy. And this is a picture of how I looked. And that was actually 1 month after radiation was over. I did not have additional treatment at all and have undergone over the years some side effects. There was no Dr. John, I wish there was, no PM&R physician. I was not referred to a physical therapist, a speech therapist, or occupational therapist. So I had to find a way to serve myself so that I could heal and thrive and continue living a life that was worthwhile. So I did begin my research, but it didn't begin until my physician, my radiologist, oncologist, recommended that I read the China study. And that was a book that talked about a study by which cancer could be repeatedly created and also reversed. And that started my journey because I was looking for a way to increase my protein intake through diet. And I did not care for the Ensure and the Boost because of the sugar content. And yes, in 2012, it was a rough time. After I went through some of that, I'm going to wait until a slide or two later to tell you some of the things that I actually did and how they helped. But I want to kind of show you a little bit more information. About 9 years after I was diagnosed, my husband was then diagnosed with a different rare head and neck cancer called anaplastic thyroid cancer. Sadly, he did pass away and it was 10 years after my surgery. But I have to tell you that it was his involvement in helping with my healing, because part of my healing involves looking at my diet. And I initially started with a protocol called Buckwheat. And then I moved to one by the name of Gerson. Gerson was a great deal more difficult and consisted of drinking 32 ounces of carrot apple juice and 32 ounces of green juice every day, along with homemade soups and salads. And what I found was there was a lot of commonality between them. And I ended up embracing what was common among them after I had done the person therapy for 2.5 years. It was very intensive in terms of it involved not only the juicing, but pretty much eating total whole food plant-based diet, not vegan, but plant-based, where meat was more of a condiment, not the main meal, much like we hear in blue zones now. And I do want to encourage everyone to know that I don't believe that all of this is the reason I have thrived over these 14 years. I do realize that these perhaps helped in my recovery extensively, but after being the caretaker for my husband and having the help with our wonderful two daughters, I know that we all have an expiration date, but the goal is to always do all that you can do to increase the probability of thriving during your surviving. And I also added many of the supplements that I've listed here: vitamin D3, selenium, zinc, magnesium, B12. And I actually found out that that is very common among all of the alternative protocols, to include the drinking of juices and the eating of whole foods. I even began to gain courage in asking for my salads to be blended when I went out to eat. So sometimes they would have a very good blender, and it was more like a gazpacho, and other times they would have a Vitamix, and it was more of a smoothie. And in fact, that's how I eat my salads every day, so that I can make sure I get my nutrition without excuse. And also, like Jonathan, I do yoga as well as walk and cardio strength training. And then one of the very important aspects is the oral care. It takes me about 20 minutes for my oral care every day, twice a day. And that's water pick, and then I floss, and I water pick a second time, and then I brush, and then that's teamed with gentle cleanings every 3 months. So I just wanted to encourage you that in spite of the long-term side effects and the fact that I did not have someone as wonderful as Dr. John to help me through, and there was very little support groups, such as the Alliance, the Head and Neck Cancer Alliance. In spite of that, I was able to thrive and then become a part of this great foundation that we are now experiencing today. Thank you.
Thank you so much, Brenda. Great presentation. Now we can move on to the next session, which is a Q&A session. We will be providing you all attendees with some slide resources. The entire presentation will be available on Head and Neck Cancer Alliance website, along with the recorded webinar. We can now take few questions. I know we are a few minutes over the hour. Um, So most of the questions have been answered in the Q&A section as we go. Maybe we can start with Dr. John. There are a couple of questions and interest in knowing more about radiation fibrosis. How long would it occur after treatment? Is it progressive? And what would be the common exercises patients can do?
Thank you for that question, Dr. Asarkar. So, radiation fibrosis, as I mentioned, it is we term it one of the late effects of radiation. So it can often come on weeks to months, and sometimes even a few years post radiation. I've seen patients come in that have not had issues or difficulties with fibrosis or scar tissue until then, but then develop it later on. So it really, again, as I mentioned, it really is an individualized approach. And so one of the things that we do in clinic is really assess like how much is your neck range of motion limited, whether it's mild, moderate, severe limitation, and what is it preventing you from doing, and really base our treatment plan on that. And so sometimes I'll start with just prescribing some muscle relaxants, kind of starting low and slow and seeing if that might help. And then, of course, going hand in hand with our lymphedema therapists and what they'll do manually to try and loosen up that fibrosis and scar tissue. And then we'll move on up the ladder if some of those initial measures are not working.
Absolutely. I think most, okay. There was one question regarding is it beneficial to complete PTOT during radiation or after radiation? I think that's a very important question, maybe. And any of the other panelists, if they have any comments, please chime in.
Yeah, I'd be curious to hear what the other panelists have to say as well, just because you've walked this journey as a patient. I would say from a rehab doctor's perspective, I know how intense radiation treatments can be. Sometimes going in, every day, depending on the type of radiation for several days or a prolonged period, and so that can be very taxing, right? To add other medical appointments to that time frame. And so I really say, concentrate on that for that time. And then once your body is feeling a little better to be able to tolerate participating in therapies, then we get you right in with therapies after that. So again, a very individualized approach from our perspective.
Absolutely. Um,
I'm not sure if any of the other panelists have any other thoughts. I'm very curious.
okay. And I think after that excellent talk by Dr. John, I think many of the in the audience want to know how to find a PM&R physician. Maybe the oncologist would be their oncologist would be the best referral source.
Yes, absolutely. Oncologists, even the surgical teams, our ENT, ear, nose, throat doctors at the university here know us and know what we do. And then I would say, any large hospital system, whether it be private or academic, university based, often will have PM&R as a part of their practice. And then there are a lot of PM&R doctors in private practice as well. So now you know the kind of the acronym and the name, and so you can hopefully in the area that you're in be able to search and find out.
Absolutely. And I had one question actually specifically regarding these variety of complementary therapies that today we have gone over, and also out there like acupuncture, so on and so forth. So how can survivors tell, or how can Alim tell if they are truly evidence-based, or is it safe to try them during or after treatment? What would your advice be? Uh,
And is that for all of
yeah.
us, Dr.?
Everyone. Like, how did y'all choose to do try one complementary therapy versus the other? Maybe I can start with Chris regarding Hariki. I know you shared your beautiful experience, but do you have any thoughts on the other alternative therapies either as well?
Mine was happen chance. because of loving animals and trying to do better for an animal we loved, I met a person who was a Reiki master. And I knew nothing about Reiki previously, but I knew I needed to calm my mind. And that's the reason I started becoming involved.
Yeah, thanks. Great. Maybe Brenda and even Jonathan, like how did y'all get into yoga? I know y'all talked about meditation and so on and so forth. So what made you choose yoga or some other therapies?
For me, I've always been movement. In fact, a month before I was diagnosed and had the surgery, I had participated in a half marathon. So I've always been very active and understood how important exercise was. It is something that I've continued to do, and I've never stopped. But I don't just do yoga. I participate in other exercise classes, extensive cardio, because I know how important that is for our cardiac artery and other things. I've also had the ability to take my time and look at some of the other exercise possibilities. And because of the fibrosis in my neck, I find, as Dr. Johns pointed out, it was so important to move it and stretch it. And so I go to different classes at different times, so that my body doesn't get so familiar with one mode of exercise and that my muscles are always kind of in confusion. So that's what I do.
Mm-hmm.
Yeah, kind of like Chris. It was a coincidence. My
Yeah.
provider referred me to a trial at Fred Hutch, and I was like, why not? But
Yeah.
yeah, it's been something that's been
Good.
very beneficial
Yeah.
to learn and do every day.
Yeah. Good. Thank you so much. So I think we are almost like 5 minutes over the clock. So let's wrap up this session. I would certainly like to thank all the panelists, Dr. John and the Alliance ambassadors, Chris Molnar, Jonathan Hutton, and Brenda Newberry for serving on the panel and providing your insights, knowledge, and lived experience. A special thanks to the Head and Neck Cancer Alliance and American Head and Neck Society for their time in organizing and hosting this webinar. Um, I think, and thank you everyone for from staying with us for the last hour or so.